Hello, my name is Ben, my pronouns are he, they, and I am the Community Engagement Officer at Thriving in Motion.
Hi everyone, I'm Felicity Austin and I use she, her pronouns. I'm an accredited exercise physiologist and I am the Operations Manager at Thriving in Motion. Okay, so it's really important to integrate exercise into gender affirming care because it's a really powerful tool, not only physically, but it can be a powerful tool socially and emotionally.
I heard it put before that if exercise could be put in a pill, everyone would have to take the pill because from the physical health perspective, from the mental health and the neuroscience perspective, there are so many benefits to moving your body. It's ridiculous. When you look at a trans-specific population, we do so much less of it for so many different reasons. And that means that we can't reach our general life goals, let alone our gender-affirming goals, because we're at a disadvantage to our peers when we don't have this incredible wonder drug of exercise.
Yeah, you're right. So we can particularly use exercise within this population to help the young people affirm their gender. You said their mental health, so we can possibly reduce their anxiety, help with the mood symptoms. And not only that, we can possibly use exercise for these young people as a really powerful social tool as well, something that they really don't get the opportunity to participate in the community.
Yep, absolutely.
Yep.
So when we say gender affirming care, what we mean is, for someone like me, I was born, when I appeared in the world, the doctor said, it's a girl, and everyone was ready for that life trajectory. And when I was in my teenage years, I said, nope, actually I'm a boy. And so then to get gender affirming care, that meant changing some things around in my social life. And as I got much older, so as I reached adulthood, changing some things around medically for myself to feel a lot more comfortable and feel a lot less distress in my body. So for me, gender affirming care included talking to a psychologist and trying to understand a little bit more about who I was and why my brain was working like that. It also involved getting top surgery, so getting chest reduction surgery. And then it has also involved taking a different type of hormone. So I'm taking testosterone, whereas before I had estrogen in my body.
Yeah. So we kind of understand it from a cis point of view as, if I can say, Ben, gender affirming care can vary. So it can be possibly a social medical model, a medical model via hormones replacements, whether that's blockers or
Different hormones.
Yep, and or surgically. Yep.
Absolutely. And then when it comes to exercise,
Yep.
if someone's looking to affirm their gender, as in if they're looking to feel more accurate in their body and in themselves as who they are, that could look like, I guess, for example, at a very, very, very basic level, you could say someone trying ballet to kind of see what that feels like on a feminine level, or someone trying AFL.
Yep.
Or we can then also look at, say, if you do a bit more upper body strength stuff, do you feel a bit more comfortable in that part of your body?
Yep.
And so on and so forth.
Yep. Yep. Yeah, I was going to say sometimes the people that come to me might want to do a bit more strength work because they might want to increase their muscle mass to become a bit more masculine in their identity. Yep.
Trans adolescents face a lot of barriers when it comes to physical activity. And funnily enough, I think the best placed person to talk about it is actually Felicity, because that's the topic of your PhD.
Yeah, so there's lots of barriers that we have researched and heard from our young people that, you know, could possibly be the barriers to participation in exercise. There is lots of, for example, the actual facility of the environment that they are going to be exercising in. So whether that's a gym, whether that's a community sporting team, or whether that's school PE, they are often set up in a cis normative or like binary model. So how do they fit into that model? There can be a lot of external stigma and discrimination when accessing these physical activity spaces as well. And also in that, what uniforms do they use? What change rooms do they go to when needing to be physically active as well? They can be really big barriers for these kids.
Absolutely. And I can say from my personal experience, I did swimming in high school and I wasn't allowed to get in the pool until I removed my board shorts. It was this whole standoff, I think, that the PE teacher was having with me for some reason. So, for an example, I really wasn't comfortable with my body to show that much skin, but that was what was required if I wanted to do the sport. Mm-hmm. I also got in a lot of trouble in netball because I didn't want to wear the skirt just as is, so I wore leggings under the skirt, and then I was taken off the netball court a number of times over it. When it came to change rooms, I didn't want to get changed in front of everyone. I felt really strange to do that, and I felt they might feel it was strange for me to do that as well. But I wasn't allowed to get changed in a toilet stall. We all had to get changed in the common area. So I used to just run into the toilet stall before the teacher could stop me, and then the teacher would like bang on the door whilst I changed, so on and so forth.
Yeah.
That kind of thing.
Yeah. Yeah. And some of the kids that come into our program may be neurodivergent as well. So trying to understand whether it's the rules or the environment, being aware of their sensory needs that they may, that could be a barrier for participation for a lot of the young kids as well.
Absolutely.
Yep.
When you end up looking at a gender divergent population, you very, very quickly look at a neurodivergent population because you're 6 times more likely to be autistic if you are gender diverse. So personally, I'm autistic, and a lot of the young people in the exercise programs that we do at Thriving are also either autistic or generally neurodivergent. They might have ADHD, dyspraxia, things like that.
Yep.
And as you were saying, that does then bring in a whole other set of barriers. And these are an additional set of barriers that you see very, very commonly in a gender diverse population.
Yeah. And how do we accommodate for those needs? Do we need a screen for those needs? Is there anything that we need to do to accommodate those needs as well to make them more comfortable for the kids coming into the programs?
Like turning down the music, turning off the lights, or, incorporating people's special interests into the activities so that they're more engaged, so on, so on.
Yeah, Minecraft theme.
Yes.
Dungeons and Dragons theme.
Absolutely.
Yeah.
Or even just favourite music. Like a lot of our young people will bring their own favourite music to play, and that really, I guess, engages the special interest, passion part of the neurodivergent brain in a way that gets them really engaged.
Yeah. So the movement program is a 12-week structured exercise program that is in the community at the moment, and it's actually part of my research, my PhD project. It's a part of the gender diversity services at Perth Children's Hospital. So what we are trying to do there is to create an exercise pathway for the adolescents that are engaged in the gender diversity services. And as we said before, offer them a pathway and an opportunity to participate in exercise and sport or various different types of movement, something that they might not necessarily have the opportunity to do.
I think for me, one of the big things when it comes specifically to working with young people who are in the Perth Gender Diversity Service is the wait lists for that service can be very long. Personally, I reached the end of the wait list as I turned 18, which means that in reality I should not have received any kind of treatment or assistance from the GDS. But I was lucky enough that they sped ran. I don't know. They pushed me through a lot of the different tests that they do so that I had documented evidence of having had gender-related distress for a long time before moving on to adult services. But there are a lot of young people who will be on that wait list for 1 year, for 2 years, and having an additional program where they can do light to moderate exercise, get all those benefits, but also engage socially, which is such a big deal and such a fantastically positive thing for all young people, but especially young trans people who have barriers to engaging socially, is really exciting and really fantastic.
Yeah. So the research kind of tells us that typically, like, trans young people might not be physically active compared to their cisgender peers. So the aims of the program are to look at their physical activity behaviours to see if we can support and maybe improve on that, while also looking at the wellbeing, the quality of life, and then looking at the other fitness measures, so looking at their strength and their cardiovascular fitness, for example, as well.
I think trans young people and their families have been involved in the design of this process from day dot. I actually first met Felicity as part of a trans young person advisory group that Felicity was coming to get feedback on the program that she was designing. So my interfacing with Thriving as an organisation began from Felicity really reaching out to community and directly asking for feedback and own voices, lived experience advising, which as far as the start of research goes is pretty good.
Yeah, like to think so. Yeah, so we've involved the community from the very beginning. So yeah, as Ben just said, we spoke with the youth advisory group that are part of the gender diversity services to get their input first. We also have a parent advisory group and a youth advisory group within Thriving as well, which we gain feedback on our programs. And we also did some qualitative research as well, which led up to the actual intervention rollout. So that was talking with trans young people Australia-wide who have been engaged in gender diversity services Australia-wide, and also stakeholders. So people like psychologists, psychiatrists, social workers, other exercise physiologists that have worked with trans young people within gender diversity services as well, Australia-wide. So that really helped to inform the design of the project and whether the project was needed as well. And then if we were to create a program, well, what did they want this program to look like? So we as exercise professionals, have our take on what a great exercise movement program can be. But yeah, you really want to tailor the program specifically to the cohort that you're working with, so our trans adolescents. You want to make it work. You want to make it tailored for their needs. You want them to be involved in the research, not just doing the research on them.
And I think you also did some qualitative interviews of parents as well.
Was that
right?
Yeah, true. Yeah, we also asked some parents as well what they see important to their children, looking at logistics, days of the week, timeframes, things like that as well.
So when it comes to the early feedback we received about the program, there's been some wonderful moments. What were some of your favourites?
Yeah, one of my most favourite moments was a young person actually even just coming to the assessment. So they were coming to see me to do their physical assessment before they actually started the program. And this young person came in, wouldn't give me eye contact, was just so anxious but excited to be there. We did the assessment, so we tested all things like their power, their strength, their flexibility, their aerobic capacity. And then afterwards I said, so how are you feeling about this and how do you think you'll go with the actual program? Well, they absolutely just loved even the assessment part. I said, well, if you love this bit, wait till you come into the next bit. It's going to be 1,000 times better. So already having that impact with just creating a safe and welcoming environment for the assessment was absolutely fantastic. Since then, the program today is the end of 12 weeks for some of our participants. So things that have really stood out to me and that parents have given me feedback on is really that there's no program in Perth or WA that has catered for their kids. So that's pretty special. So these kids have come week after week for 12 weeks and moved. They have played football, pickleball, hockey. They've done strength and conditioning sessions. They've done a variety of movements, something that they might not have experienced before. And I think they are just wrapped with the program. They are just so happy to see their confidence from the beginning to now. Just fills me with so much joy and pride and happiness for them that they've found their tribe.
I think for me, and this one might sound a bit backwards, so bear with me.
Yeah.
When you're a young trans person and you're very disconnected from your peers and you're very disconnected from sport, you miss out on the opportunity to fail safely. And what I mean by that is, in a sports context, if you fail to kick a goal, you've got all that disappointment and that, I should have done better and all that. And you get the opportunity to experience that. And once you've experienced that week after week, say, if you're part of a football team, you get really, really used to falling down, getting back up, positive self-talk to keep yourself going. And when we isolate, we don't get that emotional growth that our peers get. One of the really useful, or one of the really exciting moments for me in a twisty way, was when one of our young people felt quite upset about their capacity with sport and then got back up and was back the next week.
Yep.
Because they've just had the opportunity to work through feeling like they can't do something in a place where they feel socially connected, and they've been able to work through it and come back. And that means that they're not going to have to learn those skills as a 20-year-old. Whereas without a program like this, those would be the kinds of skills they'd be learning in a workplace at a substantial emotional maturity disadvantage to their peers. Whereas because of a program like this, you get all of those failure, success, resilience lessons in a safe way as an adolescent, which, puts us at a much better trajectory in comparison to our cisgender peers.
Yeah. Yeah, that's great. I've never actually really thought about it that way, Ben. That's fantastic. So where to next? What are we hoping to do? Well, we've only delivered one 12-week program so far in a couple of locations. So we're hoping to roll out another couple of 12-week programs for some participants, to get more participants in the program so we can get some more feedback and create an even better program than what has already been established. So we'll collect some more data, and then what we'd love to do and what we're hoping to do is to then deliver this program Australia-wide. So in other hospitals that have gender diversity services, create an exercise pathway Australia-wide and hopefully try to impact on more physical activity behaviours, support health and wellbeing in other trans adolescents, and really try to improve the model of care that they're currently getting.
I think in 2017, was it? The
Trans Pathways?
Trans Pathways.
Yep.
I was 16 when this really important research came out called the Trans Pathways Research. And one of the things that really shocked me about it was the amount of distress and sadness that young trans people reported. When you put exercise into the picture for someone who is experiencing distress, we know that it has a marked impact. And so you've got still kids all around Australia that are on long, long wait lists that don't have any support coming in to help lift them up, to help give them an opportunity to feel better. And so I would be really excited to know that there is this additional supportive element coming in to help catch some of these young people as they're either waiting to or beginning to access gender-affirming care.
Yep. Yeah. Because currently, Australia-wide, no exercise physiology service or no exercise professional is part of standard care. So we're hoping to change that and positively impact on that, which I think already we can see that. So currently we can see that there's huge improvements with the social aspect. If we can then flow that onto the psychological aspects and then the physical aspects as well will be fantastic.
Well, that's the model of mental illness, right?
Yep.
Biopsychosocial.
Yep.
And this hits all three.
Yep, exactly. Great. Thanks for chatting, Ben.
Thank you very much, Felicity.